I think it's really important for patients to be able to receive good care. And what I mean by that is when you work in a specialty, you don't just focus on the specialty, you kind of take the care of the patient as a whole. And so advocating for patients to make sure that they're receiving the care that they need at the time that they arrive, it could be very different depending on the different situations that come about. So my name is Alicia Gonzalez. I go by Lilly. I am the team lead for special populations, which oversees the addiction and chronic pain program at Family Health Center. I always thought, why is it that people of color don't have the same advantages as other people? Like what is it that is happening here? And so what helped me from this class specifically, the history of healthcare was just, it blew my mind. It was just like, oh, this is why we're here. And this is why this is happening. This is no surprise. It taught me a lot personally, but also how to apply that with the work that I do in patient-centered and also building relationships in the community. It's like, okay, they have a story too. Why do they do this? Why is it so powerful? Why are they so passionate? And why do they care so much, right? Because you would normally think like people just, work to work, and that's not necessarily true. People want to make a difference in something. Yeah. I would say, well, what do you do for work? And why do you do it? And what do you see some challenges that you face that you feel that you are not able to kind of figure out, or you don't have the answers? This course gives you the foundation, the background, and the tools. I mean, and being surrounded by over 50 people that are doing the same type of work just brings so much power and energy, because some of this work is not easy. You have to talk to people you may not want to talk to, or you may not get the answers you want. So then it just becomes very discouraging. And so when you come once a month for those 2 hours, which seems like, wow, that's a big chunk of my day, it's like refreshing. Well, I wasn't sure how many people would be in the class. So my first class, I was like, wow, like as the more people kept logging on, I was like, wow, this is amazing. And then I noticed that most of them were providers and I'm a nurse. So I kind of was intimidated a little bit, like, maybe I don't know if this was the right choice. But the more we gathered together, it was just powerful, seeing so many people with the same passion, just in a different specialty, but the same idea. How can we help? How can we make a change? It was really good to, be able to see other projects and what other people were doing. But the number one thing that stood out to me is just the power of people and how if we just keep pushing and get together, we can make a difference.